One of the world's leading pediatric care centers, the Toronto Sick Kids, had this to say about kids going back to school. They said the evidence is mounting that children may be less susceptible to this virus and may be less likely to transmit that virus to others. They also said the risks of infection and transmission in children, which appear to be minimal, need to be balanced with the harms of school closure, which is impacting their physical and their mental health. On balance, it is recommended that children return to school. And that's coming from one of the world's leading healthcare providers and pediatric centers, the Toronto Sick Kids. The American Academy of Pediatrics says the importance of in-person learning is well documented, and there's already evidence of the negative impacts on children because of school closures that have happened in the spring of 2020. Lengthy time away from school often results in social isolation, making it difficult for schools to identify and to address important learning deficits, as well as child and adolescent physical or sexual abuse, substance abuse, depression, or suicidal problems. So the science says that kids need to be in school. Well, good morning. I want to thank you all for being here. I've spent quite a bit of time this morning visiting with parents that are sending their kids back to school here in the next month or so, and then also visiting with superintendents and school board members who are making important decisions on how we do that and we do it safely for our kids and for the teachers and adults that will be in those buildings. Today, I'd like to share with you all the information that I have on that subject, and then also continue to have conversations with parents, teachers, and folks all across the state. In March, we announced our first positive COVID case in the state of South Dakota. That was more than 4.5 months ago. A lot has changed, especially as it relates to what we know about the virus and how we deal with it as it spreads through the state and also the country. When we started, our worst case scenario was based on academic modeling. That means we were using research that we knew and modeling data to make decisions. And we planned for 5,000 people to be in the hospital on our peak day in June, but we did cut that in half, and today we have less than 50 people in the hospital needing elevated levels of care to get through the virus that they are dealing with. Today, we no longer have to rely on models. Today, we can turn to real-world data that we have right in front of us. And what do we know? We know that the vast majority of people who contract the virus, that their symptoms will be mild. And we also know that the vast majority of them will recover. We know that those 65 and older are those that are in the vulnerable population, and especially if they have pre-existing conditions, that they need to take extra measures to protect their health. We know that children, although they're not immune to the virus, typically don't get a serious illness from the virus. They almost never transmit the disease to someone else. Now, from day one, I was committed to following the science, what we knew about the virus, the data and the facts behind it, and what was happening on the ground here in South Dakota. The science is very clear on schools. Our schools should be open. Let's walk through all of those facts together. JAMA Pediatrics came out with some facts, and their statement was the data indicates that children are at far greater risk of critical illnesses from influenza than they are from COVID-19. One of the world's leading pediatric care centers, the Toronto Sick Kids, had this to say about kids going back to school. They said the evidence is mounting that children may be less susceptible to this virus and may be less likely to transmit that virus to others. They also said the risks of infection and transmission in children, which appear to be minimal, need to be balanced with the harms of school closure, which is impacting their physical and their mental health. On balance, it is recommended that children return to school. And that's coming from one of the world's leading healthcare providers and pediatric centers, the Toronto Sick Kids. The American Academy of Pediatrics says the importance of in-person learning is well documented, and there's already evidence of the negative impacts on children because of school closures that have happened in the spring of 2020. Lengthy time away from school often results in social isolation, making it difficult for schools to identify and to address important learning deficits, as well as child and adolescent physical or sexual abuse, substance abuse, depression, or suicidal problems. So the science says that kids need to be in school, but the next question is should kids be in masks? That's something that we're hearing about every day here in South Dakota as well. Let's go back to what the doctors in Toronto have to say. They say it is impractical for a child to wear a mask properly for the duration of a school day. In younger children, masks could be irritating, which may lead to increased touching of the face and therefore increased risk of infection. You all know that I'm opposed to a statewide mask mandate. I've been clear about that. Today, my focus is that schools need to create strong plans to provide each person the opportunity to have in-person instruction that works for each family. Remember that the number one non-pharmaceutical way to kill this virus is by washing your hands. Now, the vast majority of teachers and staff are not in the high-risk, vulnerable population category. If they are, there are many options that are available to them. Social distancing, masking, proper hygiene. If they need to teach online classes, there are so many school districts that are making accommodations for that. Let's come up with a plan to make sure that we're protecting those individuals. But we cannot sacrifice the educational, physical, emotional, and social well-being of our kids. The risks of COVID are too minimal for us to make sure that they're all going to stay home and take the risk that we take on social and emotional well-being of our children. No one wants to put these adults at risk, but also, as Dr. Scott Atlas at Stanford has noted, risks to adults in schools are much less than those that are encountered in grocery stores, pharmacies, and other essential businesses. So for many students, the consequences of not being in school are far greater than the health risks of dealing with COVID. Kids thrive on routine and in being in a supportive social environment. Long-term remote learning can't replace any of those needs. Lots of human connections can lead to a better way of life. If you lose those human connections, it can lead to increased stress, anxiety, and depression. Closing school buildings has a significant impact on our most vulnerable students. Our school nutrition programs have done an absolute fantastic job making sure that we're continuing to make students meals for them, that we're delivering them to their homes and having access. But some kids have been disconnected from that daily, consistent nutrition that they received when they were in school full-time. Not all kids are in safe home environments. For some students, school is the safest and the most predictable place that they can spend their time. The Journal of the American Academy of Child and Adolescent Psychiatry says the duration of the quarantine, infection fears, boredom, frustration, lack of necessary supplies, lack of information, financial loss, and stigma, they appear to increase the risk of negative psychological outcomes. Social distancing and school closures may therefore increase mental health problems in children and in adolescents. Early indications of the COVID-19 context indicate that more than 1/3 of adolescents report high levels of loneliness. So our state's future depends on educating these kids. I want to remind everybody that I'm a mom too. I'm also a mom of a boy who struggled with asthma, breathing problems his entire life, and very severely dealt with that for many of his early years. I can't tell you how many moms and dads and kids have reached out to me and said, we need our kids back in school. Give us the flexibility to take care of our kids and do that in a responsible manner. Online learning got us through the initial crisis that we faced, but it is absolutely not a long-term solution. There's a very good piece in the Wall Street Journal that I would encourage all of you to read, and it outlines why remote learning just didn't work. Preliminary research suggests that students nationwide will return to school in the fall with roughly 70% of the learning gains in reading relative to a typical school year. That means they only received 70% of the benefit that they typically would have received in a normal year, and less than 50% of the benefits of learning in math. There's an even greater loss for minority and low-income children. Now in South Dakota, we are blessed to have fantastic and committed educators, teachers and administrators who step up each and every day to make the best decisions for our children. I've heard countless stories of teachers classroom instructors at all levels who went above and beyond to make sure that they were still delivering lesson plans and care to those students who needed it in very uncertain times and in unique situations. They all made sure that they got through COVID-19 remote learning in a way that worked for each and every family. But as good and as committed as those teachers are, they couldn't reach everyone. Not every student participated in online learning. As many as 30% did not participate in some circumstances. Now think of that. Some of our schools haven't even heard from these kids since March. That cannot continue. So I've shared with you many times that my goal as governor is to make decisions that benefit the next generation. What we do today should be a catalyst for how our young people are prepared to start businesses, be successful, invest in their communities, grow their families, develop their careers, and have a quality of life here in South Dakota. So right now, the best decision that we can make for our kids, for their full development and their well-being, is to get them back in school, because their future does depend on that. And with that, I will open it up to any questions that you might have for me. Sure.
Shall comment with you, obviously, here.
Sure.
Can you talk about how federal aid and state aid will be supporting these schools to make this transition in the fall? And
Yeah.
how much will be used?
Our school districts are facing extra costs that are incurred because of the needs that they will have to address within their buildings and to facilitate the hand washing, social distancing, things like that. So there has been about $47 million that has already come into educational systems in South Dakota. There also will be more funds that will be allocated from the state and federal government coming forward. In fact, I believe the bill that Congress is putting together now will be largely focused on getting some relief to deliver education and get kids back into classrooms. So while those costs are there, I believe they will be adequately addressed through resources that will be hitting our school districts and help them make sure that they're prepared for this next school year.
You had mentioned the 30% not participating in online learning in some cases. Can you unpack that a little bit? Was that across the board or in particular schools, or just where that is coming from?
Yeah, it's different for every school district, the amount of kids that didn't check in and what level of education they experienced and participated in. In many of our school districts, the kids and the parents weren't heard from, and administrators reached out to them to see how they were doing, but many of them we haven't had contact with. And I would say that one of the populations that this is very true for is our most vulnerable populations, those kids in high poverty areas, those kids that maybe don't have a support system around them. And those are the ones that I'm really concerned about. When we have a school district that makes a decision not to be open, many times the children that are the most vulnerable to falling behind and being neglected are those individuals in that community that need to be in the building. I think every teacher and administrator would say there's times that they saw a child come to school and it made them concerned for something that was going on in their life, that they helped bring in support and identified some concerns that they had. And that's what I think needs to be addressed and to be looked at, is those vulnerable kids that are disadvantaged already, how much more it's going to hurt them if they're not in the school building each and every day, getting a warm meal, having people who care about them, addressing concerns they may have in their lives.
Can you speak to some of the concerns and other comments you heard from parents and administrators this morning?
Yeah, I think it was great feedback on some of the things that they're wrestling with. Parents certainly have opinions on how they want to see schools opened up, safety measures that are in place, but they also want to balance that with common sense. They know their children, and they know their children need to be in the building to learn and as much as they possibly can to be prepared for life, but they also know the realities of facilitating that in a public health responsible way. I think from the administrators, it was a different perspective. You know, they're dealing with all the details and logistics that it takes to make it happen and address a wide range of concerns. You know, they're hearing from people all across the board who have opinions on every issue. So my goal is to help them get as many answers as possible, but also know and reassure the public that we're still dealing with a virus that we're still learning about. We know a lot more today than we did 4.5 months ago. And that also many times people want black and white answers, and this isn't a situation where we can give them that. That every day we're going to stay teachable and learn, see how things go, and make adjustments that make sense. But that there is a balance. That's the thing that was refreshing to me today, was to hear that every person really recognized the benefits of making sure that their kids were in a classroom. There was concerns about how it happens, but they all recognized that their children lost opportunity by not being in the classroom and learning. They also recognized that they were missing the social interaction, that their kids were struggling more emotionally with not having a normal way of life. They're concerned about their kids dealing with anxiety and fear based on what they see on TV and how adults talk. And so I would encourage the people of South Dakota to wake up optimistic, wake up happy, and communicate that to your children. If you turn on the news and watch that with your kids, remember and try to think about how that impacts them, and remind them about what's special about each and every day and the opportunities and the good things that they have, because it does have an impact on kids mentally and emotionally, and we need to remind them that they still have a wonderful life and a lot of road ahead of them to where they're going to be successful.
Governor, can you talk about how your office might be working with the Department of Ed to provide opportunities to get that 30% back on track in the fall?
Well, we have been working with them extensively, and the Department of Health is making tools available and opening up processes with each school district. The school districts are the ones who have been reaching out to a lot of the families, but to be candid with you, we've had a dramatic decline in child abuse reporting that has happened, a lot of decline in neglect reporting, and it's because our schools aren't seeing these kids and we don't know what's happening at home or wherever they are. And that's my concern, is when kids fall off the radar, it's often not a good thing. And so that is the accountability measures that we need to have back in place, and it's a role that our schools fill, and it's going to allow us to make sure that we're identifying those kids who really do need the help and get out there and support them and take care of them.
Can you possibly be more specific on the dramatic decline?
Well, it's significant. We can get you all those data points if you want, but it's hard to predict exactly the number of kids because we don't really know what situations they're in. But there has been a decline in reporting of those types of cases, basically because people have not been interacting to where those kind of cases get reported. Stephen?
I think you said in JAMA as far as masking for kids. At the same time, the Medical Association has called for masks to be required for kids in schools. I'm wondering how you balance that with, that wearing masks or taking other preventive measures might help schools stay open during the fall, might help prevent the resurgence of the virus, and why not encouraging or recommending that schools wear masks?
Well, the reality of the situation is that there's very, very low transmission rates between children. Children rarely get seriously ill. If they do, many times they have an underlying condition that has caused the virus to create complications for them. And I think the common sense of how kids handle masks and the reality of them keeping them on for 7-8 hours a day is going to be a challenge in how they learn. I mean, Stephen, just watching you during this press conference, I think you've touched your mask probably 6-7 times. So, I mean, that's an adult. And that's the struggle that we all have. And I think having kiddos sitting at their desk trying to learn while they're fidgeting with a mask and trying to breathe and not have it bother their nose or their ears, all of that is a reality that our teachers and our administrators are going to have to deal with. And if the most effective thing those kids could do is be washing their hands on a regular basis throughout the day. And especially since there's very low transmission rates between children, I think it is an option for kids and parents if they want to pursue it, but it should not be mandated.
Governor, if there was to be a bad outbreak in a school, does the state kind of have a plan on how they would handle that situation?
We are telling school districts that they not set a threshold on positive cases. As you know, in the state of South Dakota, we've always focused on hospitalization. and how many people are in the hospital and the capacity to take care of people should they get sick. I think every school district's approaching it a little bit different. Some of them are thinking of ways that if they have an issue in a classroom, isolating that classroom, and notification processes, giving parents as much information as possible. But I am encouraging them not to set thresholds for if they would decide to call off school or not call off school, because they will be calling off school all the time. And that inconsistency will create more uncertainty for these kids and those teachers and make it even harder to learn. That this is a virus that we've said for months is going to spread across the state of South Dakota. We will continue to see increased positive cases. We're going to go up and down and get through this, and we just need to make good decisions to help us get through it in the best way possible.
There's a resurgence that's bad enough. Is it a possibility to close schools statewide again?
I believe that we've learned so much about this virus and how to deal with it that we're in a situation where that's not something we're looking at today. But we will always continue to look at the facts. But I think that with what we know about how this virus impacts children and the other consequences of calling off school, that I don't see that in our future. Other questions?
I did have one question,
Sure.
but it's not related to schools, if that's okay.
I think it's fine.
Okay. I was wondering if you could talk about the Upskill program
Mm-hmm.
that you just announced.
Yeah, the Upskill program is going to be fantastic. I hope people will participate in it. It's going to give us the opportunity to utilize our technical universities in a way that will give people an educational a point to where they can create a skill that will fill a job need that we have, that would get them into a higher paying job and an opportunity that they didn't have before. So I'm hopeful that folks will recognize that even though we've had some challenges, this might be a unique opportunity for them to get the training they need to get a job that would help better take care of their family into the future. And reach out to our technical schools, reach out to our Department of Education. We'd be more than willing to help set people up with that.
And is this for people who are on unemployment right now? Is it for anyone?
It's for everybody.
Okay.
We're hoping that people will reach out and really understand the opportunity that they have in this program.
And what do you think this means for the state of South Dakota?
Well, the state of South Dakota is a bright spot right now. We have job opportunities. We have one of the lower unemployment rates in the nation. Everybody here works and they work hard. But this gives them an opportunity to learn a skill that gets them into a higher paying job so that they can be more successful and pursue that dream that they've always had. And so this kind of innovative approach to getting that skilled training, I think, will be very helpful in helping us help our families do better.
I have one last question
Yeah.
related to COVID.
Sure.
Can you talk about, as new information is coming out every day about the virus, how you're prioritizing the sources that the information your office is sharing and the decisions you're making?
I'm reading it all. I am reading it all, and that is why we've been challenged, is because it's been all over the map. What we do know is more data and information about how other countries are having results, how our researchers are identifying the virus and how it spreads. Even the CDC is changing their recommendations quite consistently. So that's all beneficial, and we need to continue to read and stay up to date on what we learn each and every day. I never take anything off the table, which is why the mask situation with kids and with adults is very mixed research, and the science has not proven what's effective and what isn't and what type of mask. We have to stay objective when we look at it and really look at still the most helpful thing that you can do each and every day to help slow down the spread of the virus is to wash your hands.
Appreciate it. Thank you guys.
Yep. Thanks, guys.